My name is Joe Kavita. I'm the Vice President for Connected Health at Partners and the host of this event, and I'm delighted to bring you into this session. This is always by far one of our most popular sessions, the Innovators Challenge. It starts out with a large group of people who apply, a committee, a disinterested committee evaluates them all, and we have our finalists today are going to give you short pitches, and I'm in their way. So I'm just going to introduce our moderator, who is perfect for this session. Deborah Estrin is a professor of computer science at Cornell Tech and is also a professor in the School of Public Health at Weill Cornell Medical School. She's been the founder of a number of interesting and really groundbreaking efforts around open data, including the Open mHealth Consortium, as well as the Small Data Lab at Cornell Tech, which develops personal data APIs and applications for individuals to harvest small data traces they generate daily. Sound familiar? That's what we've been talking about already all morning. So without further ado, please give a warm welcome to Deborah Estrin.
Thank you, and I get to disclose that these are 10 winners who were not 10 out of 12 or 10 out of 20, but 10 out of over 150 online applications. So that's wonderful. And just before we get started, and I'll be the one, they invited me to this because they know that I'm impatient and not overly polite. So I'll be getting people off stage quickly. Before I do that, I want to let you know that their Patient Shark Tank is having patients evaluating these patient-centric innovations in real time as they're being presented, and there'll be an announcement tomorrow of the most disruptive innovation. So without further ado, I'm delighted to introduce Larry Walters from PreSimTech. And Larry is the president and CEO, and he has over 30 years of experience in law and business. He's led and assisted several growth companies to become market leaders, and he sees technology as providing an early medical intervention and as a really critical element in improving patient health and lowering costs.
Good morning. Again, I'm Larry Walters, President and CEO for PreSimTech Medical. Pre-symptom technology. We can accurately predict sickness in advance. In fact, up to 2 days before most symptoms, and that can make a significant difference in the life and health of those with chronic diseases. We are the check engine light for health. And if you think about a check engine light for a moment, it sits on the dashboard of your car, monitors the health of your engine, and when something goes wrong, it gives you that early alert in time for you to take your car into the professionals, have them check out what's wrong under the hood, and fix it before it becomes a major problem. And with our check engine light for health, we are poised to save the healthcare system billions of dollars, and I'm excited to show you how. The problem we're focused on is to reduce the cost and complications of those with COPD, chronic obstructive pulmonary disease, a $50 billion spend today, projected to be $90 billion in 5 years. And COPD is the third leading cause of death in the U.S. and affects 8% of our population. It is often associated with debilitating exacerbations that require very prompt treatment. In fact, a delay of only 24 hours in treating an exacerbation more than doubles the hospitalization rate. Interesting fact, 70 to 80% of these COPD exacerbations are the result of an infection. And yet with this, there is no early warning system for infection permitting intervention, earlier intervention, for better outcomes until now. And that's PreSimTech. PreSimTech is a decision support tool. It engages patients to help them better self-manage their health. Our objective, evidence-based alerts change patient behavior. We can accelerate care by getting them to the doctor 2, 3, even 4 days before they normally would go based on symptoms alone. We're a daily monitoring and alert service because if you think about it, there's no shelf life on health. You can acquire an infection any day. So therefore, an infection-sensitive COPD patient needs to monitor for it every day to catch it as soon as possible. But you need something that's quick, easy, non-invasive, and simple. The key is knowing when to act, even before symptoms, and then to act quickly. PreSimTech is available 2 ways. First of all, our internet service using discrete devices such as a thermometer and peak flow meter. However, the best way to use PreSimTech is with our new patented wireless handheld monitor that we're developing. It automates the daily readings in less than 15 seconds, has an onboard screen for immediate reporting, and also has tracking and wireless delivery of our data to our servers for noticing, to care professionals, and to families. Using our internet service as a test, We would first log in with ID and PIN, then the patient would put in their readings for that morning. 98.6 seems like a normal temperature, and although this patient is normally a 500 best peak, at 300 they're a little below lung efficiency today. There are a couple of screens to record any developing symptoms, and then there's the report. 5 levels, low to high, color-coded green to red, and if you get an orange or a red that day, that's an indication of alert, and we're projecting a high respiratory infection today based on those readings we just put in, and this patient needs to see the doctor as soon as possible for an evaluation and treatment. Our algorithms have been validated through 3 prior studies, 2 in Asia and an IRB study in Pennsylvania, and we were delighted with the results, high 90 percentiles for specificity and sensitivity. When you look at the market for COPD, the financial impact is enormous. We spend approximately $16 billion in infection-induced exacerbations that lead to hospitalizations, and that number is slated to almost double in 5 years. If we could save only 2 out of 10, we could save our healthcare system $3 billion, and hopefully we can do even better. I show you this study just to demonstrate the value of early intervention for COPD patients. Although we were not a part of this study, at the moment of exacerbation, the COPD patients in the treatment group were given breathing exercises, antibiotics to handle bacterial infections, which are so prevalent for COPD patients, and oral steroids. At the end of a year, they were able to reduce emergency room visits by 50% and hospitalizations by 60%, and they started at the moment of exacerbation, and PreSimTech is a day or 2 before that. Of course, early intervention is no surprise to those in connected health. We know that early intervention is the hallmark for connected health because it delivers better health, lower costs, it's cost-effective, and it reduces hospital admissions and readmissions. And now I'm delighted to say that those same benefits are available for developing infections. And to our knowledge, we're the only company focused on early intervention for significant infections. So in summary, early intervention into the infection leads to reduced exacerbations, fewer hospitalizations, lower costs, and better outcomes for everyone, patients, providers, and certainly payers. Thank you very much.
So our next speaker up will be alternating podiums is Julia Hu. She is CEO and co-founder of Lark, a mobile health and VC-backed startup who's using artificial intelligence to transform chronic disease management and prevention. They were called the most innovative digital health product of the year by Wall Street analyst Forrester Research, and they are pre-installed on all Samsung phones as the Siri for health. Lark is a text message coaching service with the highest user engagement in the digital health industry. Julia.
Thank you. Ever since I was little, as little as I could remember, I remember waking up in the middle of the night with a horrible pain, like my stomach was eating itself. And it would just last all night. That lasted for all my life. And for 20 years, no doctor could diagnose my symptoms, my chronic condition. I really don't know what I would have done without my parents, my health team, my nurses, my doctors, not just supporting me medically, but emotionally. I learned to manage my chronic disease by eating healthier, being really strict on exercise and not stressing too much. And by then, most of my symptoms went away. So when I left for college, I realized I'm really not alone. $1 trillion every year in the US is spent on managing and preventing chronic disease. But it's really impossible to have that health team in your pocket or that personal health nurse that follows you around everywhere. Until now. Over the last 5 years, Lark has worked with some of the biggest and most wonderful health leaders in the world. Behavior change experts from Harvard and Stanford, domain experts in diabetes, NBA coaches, nutritionists, and together with the cutting-edge AI specialists, we have created the world's first AI personal health team. So imagine anytime you want to text with someone, Lark is there in your pocket.
Eggs, bacon, and a side of toast and coffee.
use all of the low-power sensors in your phone and in the Internet of Things to passively track all of your health and coach on it in real time. So it's like a coach talking to you within 2 seconds. We've created 2 products, one for metabolic syndrome and one for diabetes. We've been lucky enough to be called a couple of cool things over this last year since we've launched. More than 2,500 patients have rated us almost 5 stars, and we have been named Best New App by Apple and Best New Health App by Macworld. Now, why are payers and pharma working with Lark? And I think it boils down to 3 numbers. The first, 350 million. We, in the last 3 months, have exchanged 350 million text messages, personalized, with our users. If that is a real coach doing the analytics and then doing the text messaging, that's equivalent to 25,403 live full-time care managers and nurses. And we think that this really can change the way that people manage health and chronic disease, because it's all about these small nudges in behavior change. And finally, while I can share much of our great health outcomes, I'd love to just end with a more personal story. Liz, one of our users, lost 26 pounds with Lark in a healthy way. And she wrote this about Lark. Lark actually cares about how I'm feeling. I can check in with her anytime on my phone, even 1 a.m. on Sunday. It's been so long since someone believed in me and made me feel good about myself. And that's why I think care in healthcare is so important. All of our doctors and nurses do so much for us, but they can't be with us 24/7. And so we hope that we can bring that care and love into the world. Thank you so much.
So we see a decided advantage to the right side of the stage. I'll have to work on that. So our next presenter and winner is Hirsch Vatsangam, and he received his PhD from University of Southern California. He used to be on faculty there. And he's working at the intersection of big data and mobile health. He has an undergraduate degree from IIT Madras, and he has a passion for taking technological solutions and applying them to benefit people's lives. So, Hirsch, moving analytics.
Thanks, Deborah. Good morning, everyone. My name is Hirsch, and I'm here to talk about moving analytics. Let me describe to you what the problem that we solve. Cardiac rehab is a program that's offered to patients after they've had a recent heart attack, heart surgery, or heart failure. A patient who does cardiac rehab doubles their chance of living another 5 years and cuts their risk of readmissions by half. This is a program that literally saves lives. The problem is that only 20% of patients who are eligible even enroll for the first cardiac rehab class, and only 5% complete it. And the reason for this abysmal participation is it's expensive and inconvenient. If I were a patient and I wanted to participate in cardiac rehab, I would have to visit a hospital 36 times and spend $1,800 out of my pocket as copay. This lack of participation is bad not just for a patient, but for hospitals too. So the average hospital loses up to $2 million in revenue each year through reimbursable expenses because patients don't come to rehab classes. And as hospitals are transitioning to value-based payment models, they will have to bear the cost of patients getting readmitted, which basically increases if they don't do rehab. So hospitals are looking for ways to increase participation in rehab, but are constrained by a lack of physical space. And so that's where we come in. We at Moving Analytics help hospitals implement home-based cardiac rehab programs. We're based off MultiFit, a home-based program that was developed at Stanford. Over 20 years of research and over 17,000 patients, the MultiFit program was shown to be as effective as in-person cardiac rehab, while also having a 90% completion rate. What we've done is we've taken that program and digitized it into a case management dashboard for nurses and a mobile app that patients can use to receive cardiac rehab in the comfort of their homes. Let me take you through how it works. So When a patient is discharged, the nurse creates a customized care plan for that patient and helps them download this plan as an app on their smartphone. After initial tutorials and onboarding, the patient is sent home with that app. As the patient at home, the app basically guides them through daily rehab goals and reports the progress back to the nurse. As the patient, once a week, the nurse actually calls the patient, checks in on their progress, identifies any roadblocks. At this point, we make this process really easy by identifying key talking points that the patient is going through based on their progress through the program, and also what the nurse has to do in terms of checking in on them every week. This goes for 12 weeks, and all of this is done at home. The patient can also ask the nurse anytime for questions related to their care. So care that's delivered this way is really convenient because most or all of it is done at home. It's also great for a hospital because they get to serve hundreds, if not thousands, of patients with little or no infrastructural overhead. Because more patients do rehab, the risk of readmissions in their patient population go down. And that's really how we benefit this. Since launching our product, we've actually signed 4 hospitals as customers, and I'm happy to report a little bit of progress with respect to the first 2 clients that we've rolled out. Patients enrolled in our home-based cardiac rehab program had an 80% retention and also met twice the recommended activity or exercise levels in their population. That's a key indicator of cardiovascular fitness. And we're expanding this program to more patients in the coming days. We have an amazing team to take this further. Ade has a deep experience in technology commercialization. Joan and Chow have designed over 20 world-class products between them. Nancy Miller and Linda have 35 years in developing, they're basically inventors of multifit, and they have 35 years of experience in developing and validating and delivering these remote rehab protocols in patient populations. And that's what our clients get when they work with us. There's a lot more that I can say, but I'd like to end with this thought. A patient who does cardiac rehab doubles their chance of living 5 years. I'd like to ask you, what does 5 years mean to you? The time spent with your family, vacations, time spent with your loved ones. The shocking fact is that 80% of patients after heart surgery don't get that benefit. And to me, that's abysmal. We are here to change that. Our vision is to make cardiac rehab accessible and a reality for all. And we're looking for people to work with us. If you'd like to learn more, come talk to me. It's very easy to spot me with this pink jacket, and I wish you a great day. Thank you.
So next up is Omri Shore, who is CEO and co-founder of Medisafe. Medisafe is his 3rd tech startup, began in 2012, after his diabetic father accidentally took a double dose of his medications. So with that, Omri.
Thank you, Deborah. Good morning, everyone. My name is Omri, and my father is okay, just for you to know. Medisafe is a patient-centric medication management platform. We are the leading platform in our space, with today nearly 2.5 million users who downloaded our app and started using it. Platform, not a medication reminder, because medication management and adherence is far more complicated than just memory. There is cost, there is support, and there is the patient who's sometimes not engaged enough. So we are about to demo a bit of Medisafe today. So this is Medisafe. And the user experience was specially designed to resemble a real pill box that patients actually use. Inside you can see 4 quadrants: morning, noon, evening, and night, so that the patient can actually look at the app and understand with a click of a button that he actually took his medications with the check mark. In Medisafe, we have 2 secret sauces. The first one is that we connect family members, so that if my wife did not take her medications correctly, I get notified about it. The second one is a feed component, which resembles a LinkedIn or Facebook feed. With 250 million doses taken using Medisafe to date, we have the technology and the know-how how to personalize the experience for the specific patient so that he gets a personalized, more engaging experience. Let's take a hypothetical consumer named John. John is also hypothetically our head of marketing and is sitting hypothetically just in front of me. So let's take John for a second. And John just started taking a new med called Diovan. Inside Medisafe, he can actually see a physician explaining him more about his medications, of course, when we have internet. Inside Medisafe, as we were trying to make the user experience far more engaging for consumers, we've added medtones, similar to ringtones on your iPhone, making sure that you actually take your medications correctly. We have Obama here reminding you to take your meds, my nagging mother, but we're here in Boston, so let's see how that works.
Smart to take your meds. You got a habit or something?
So, do it again.
Hey, what you trying to do? Kill yourself? Take your meds.
So a bunch of playful.
Hey, what you trying to do? Kill yourself? Take your meds.
This is with a Boston accent. Earlier this year, we've introduced our way of bringing the patient's medications into the app. Today, over 80% of the US patients can automatically download their medications into Medisafe. In Medisafe, we also allow the patient to pull his measurements inside the app through Apple's Health Kit. What you can see here is our way of intrinsically rewarding the patient to take his blood pressure down by seeing his blood pressure tracking alongside his medication adherence that is becoming better all the time. John can also learn inside Medisafe about sex and heart diseases. Now he knows that this is okay. He gets his refill reminder when it's time to refill, and he gets a MedFriend alert when his wife forgets to take her birth control pill. John also takes Cialis, but this he doesn't need Medisafe for. Well, finally, we also show John how he's ahead of the pack. I invite you all to come to our booth, learn more about Medisafe, and hear what we can do for your patients. And one last thing. I'm super excited because
He doesn't
today,
get it because he characterized all mothers as nagging.
So today we're sharing our research about how Medisafe helped tens of thousands of patients
At your booth.
at our booth.
Go to his
So I
booth.
invite you
Okay,
to come
great.
there. Thank you.
Next up, and that's what I do to friends. I know him a long time. Dr. Robert Stone from Design Solutions contributed to the acceptance of 2 disruptive technologies in health and medicine, both pulse oximetry and newborn hearing screening, which have become really ubiquitous. He's been engaged in medical device design and development for 35 years and holds more than 20 issued patents.
Thank you for the opportunity to present for you today. I'm going to talk to you about the Eshirt. I have to tell you first a little bit about my philosophy with regard to medical devices. I talk about Bob's 4 primary rules for a successful medical device. The first is that it has to make or save money. The second is that it has to be easy. The third is that it has to be easy. And the fourth is that it has to be easy. And I lied because there's one more: it has to work. Most engineers approach it from just exactly the opposite direction. They have something that works, and then they go out looking for a problem for which that solution applies. We don't do that. What we want to do is to leave people well enough at home. People don't want to sit down in front of a console each morning. They don't want to answer a bunch of questions. They don't want to have intrusiveness in their lives. What they want instead is to stay at home, especially as they get older, as they see the effects of age dealing with them. So, what we have is an aging population. This country and other prominent countries in the world all have an aging population, and aging population needs more monitoring, needs more health care. We have high rates of chronic disease. In fact, 45% of our population is estimated to have at least one, if not more, chronic conditions. We have a growing shortage of doctors and nurses. This year, it was estimated we have a shortage of 63,000 primary care physicians, and that's expected to triple in the next decade. We have skyrocketing hospital costs. Hospital costs in the US are at least twice what it is in other developed countries, and they continue to grow higher and higher. And we have a desire to age in place. No one wants to go live in an assisted living facility when they're comfortable living in their own home, when they're comfortable getting themselves around. But as our parents or ourselves age, we want to be sure that we're safe in doing so. So what is the Eshirt? The Eshirt continuously monitors and wirelessly transmits a broad range of high-quality vital signs reliably and cost-effectively to paint a high-resolution picture of health status. It connects people simply and comfortably to medical professionals and loved ones at any time from anywhere. It's uniquely positioned to enable healthcare systems to reduce both hospital admissions and readmissions among the elderly and the chronically ill. So it provides quite a bit of information. You can get a glimpse of the picture of the product itself on the person that's wearing it. That's actually a 45-year-old physician who's wearing the female version of the garment. Just a quick comment about the garment and why we think people will wear it. We went to Aura, a very high-end lingerie designer in London, and had it designed so that the garment for ladies is a camisole. For men, it's a vest-type undershirt, and yes, I may do a Superman at the end of this and show you that I'm wearing one. So what does it provide? It provides a complete equivalent of a 3-lead ECG with no requirement for electrical contact to the skin. We have a proprietary new type of capacitive pickup that shields out interfering noise and provides a high-resolution ECG that's adequate to detect not only heart rate, but also arrhythmias of various types, and we've demonstrated that we can actually pick up the missing R wave, no, PQRS, the T wave, in order to, no, it's a P wave, the missing P wave in order to pick up atrial fibrillation. We also pick up the respiratory rate and the amount of respiratory effort for a given person. We pick up body position, activity, as well as automatic fall detection and skin temperature. From that, we can get calories burned as well. It's a reliable, high-resolution picture of health status. All that's a nice lot of data, but doctors do not have time to look at data. They want information. The device has limits that are set and anomaly analysis and can automatically send a text or an email message to a care provider as required. We're running out of time.
We are.
Finally, we provide that information not only locally, but it goes into the cloud, into an FDA-approved app where that can be used and and care providers can be automatically notified.
Superman at the break. Okay.
Superman at the break. Or right here. We're
There we
wearing
go.
it. Okay.
Nice. Thank you. So next up, we have Matthew Bars. He's a clinical psychologist and a board-certified tobacco treatment specialist. He's the clinical director of the Fire Department of New York City Tobacco Treatment Program and Jersey City Medical Center IntelliQuit smoking program. And he's works on a biochemically confirmed quit rates and achieves over 50% success.
Thank you. Good morning, Boston. Matt Bars, CEO of IntelliQuit. So, in case you missed it in the news, smoking is really, really bad. Tobacco is responsible for 450,000 deaths annually in the United States. Globally, it is estimated if current trends continue, tobacco will kill 1 billion, that's with a B, people this century. And tobacco costs the US economy hundreds of billions of dollars in healthcare costs and lost productivity. Smokers know that cigarettes are bad too. They know it so acutely that over 70% of all smokers want to stop. And every day, 79,000 smokers in this country attempt to quit, although 95% are unsuccessful if unaided. Despite those incredibly large numbers, most smokers would prefer to cut down and then stop. No one would expect a dieter to lose 20 pounds overnight, and in that regard, smokers are no different. Unfortunately, just counting cigarettes is inadequate and terribly biochemically inaccurate. Introducing IntelliQuit, the world's smartphone breathalyzer for smokers that transmits its results wirelessly via Bluetooth to the smoker's smartphone. Similar to a calorie counter or weight scale for dieters, IntelliQuit biochemically measures real tobacco consumption, transmitting those results wirelessly via Bluetooth. What happened? Whoops. Okay, well, we're jumping ahead. I didn't touch anything, honest. You can see our device is smaller and lighter than a butane lighter. We're very proud about that. Expired breath, or I should say ambient tobacco, ambient air is 0 parts per million. After exhalation, a non-smoker typically blows 0 to 3 parts per million. Smokers much higher, dependent on proportionally how much they actually consume. A 1% decrease in tobacco consumption actually transmits to a 3 to 4% probability of actually quitting. But that's not all. Our rich functionality includes a real-time, real-world mobile app video coaching platform, medication adherence, GPS-enabled smoking logs and other aspects of the smoker's digital pulse, and our mobile game, Smoke the Zombies, where the goal is to kill the zombie cigarette before the zombie cigarette kills you. Zombies are huge. Who knew? Our business model consists broadly of B2B and direct-to-consumer verticals. Using telemedicine insurance regulations and statutes, this will generate $1,200 to IntelliQuit and our clinical partners, and we plan on securing approval as a durable medical device. As of July, 2/3 of all smokers in the United States can receive this without direct out-of-pocket cost. We're very excited about that. IntelliQuit-driven tobacco treatment can literally save state budgets from bankruptcy. In my home state of New York, 54% of New York Medicaid subscribers are smokers. That represents approximately 70% of all the smokers in the state of New York. And more than 50%, significantly more than 50% of New York's entire state budget is spent on Medicaid. Here in Massachusetts, a statewide office-based traditional tobacco treatment program engaged 40% of the state's Medicaid smokers, increasing quit rates 10%, and reducing hospitalizations from acute MI and cardiovascular disease over 40 to 50% in less than a year and a half, and that's just cardiovascular effects. I know. Return of investment over 3 to 1. We'll be hanging around, and we're happy to talk with everyone. Thank you.
Thank you. So next up is Frank Mcgillin from Neurometrix. He's the Vice President and General Manager of Consumer Health, and his expertise is in building health and wellness businesses in entrepreneurial environments and companies such as Johnson & Johnson and Philips.
Great, thank you, thank you. Well, we're excited to have a new type of wearable device, and it's a device that goes beyond simple tracking to also deliver therapy. So we're really actually going to help have a way to get beyond the typical retention rate problem with wearables. So we're targeting chronic pain, and the problem with chronic pain is huge. 100 million Americans suffer from chronic pain. Over half of them feel like they're not getting relief from their medication. Bulk of them say it interferes with their sleep, quality of life. 16,000 medication overdoses in 2014. And the cost of chronic pain is just tremendous, $600 billion. So it's costly, the population's underserved. We believe there has to be a better way. And that's what we thought about with Quell. So what we've done with Quell is really combine the best of wearable technology, personalization, wearability, the fact that it's quantifying, the fact that it's connected with classic Class II medical device. So this is an FDA-cleared Class II medical device. It's gone through all the rigor of FDA clearance, all the quality controls, et cetera. So what I want to introduce to you is Quell, and it's the first wearable device for chronic pain. And I think the key benefit is it's 100% drug-free. We spoke to thousands or hundreds of consumers developing this, and so it was the one thing you'd like to see in an alternative treatment. They said, I want drug-free. I hate the drugs. We have something we call optotherapy. So the device is actually customized to your unique needs. So there's an algorithm in it that will actually detect what therapy you need. We deliver high therapy or high intensity nerve stimulation is the way we achieve achieve chronic pain relief. It's unique. It's worn on the leg. So if you think about typical devices where you put where it hurts, Quell you wear on the leg because we're tapping into the central nervous system. So we're delivering a systemic response in a way that's very discrete and individualized. We're able to track therapy through a companion app. We also are able to track sleep, and tracking sleep is really important for a patient with chronic pain because there's a huge linkage between sleep and pain. So we know if we can actually help improve their sleep, that we're helping improve their pain. And then finally, we really focused on having a human-centered design. We worked with IDEO in terms of optimizing the design for Quell. This is a product that some patients or some people will live with 24/7. So we knew it needed to fit with their lives. We knew the app needed to be very intuitive. We didn't need a lot of buttons. We wanted to make sure that once you had Quell on, you could kind of basically set it and forget it. It's clinically proven. It uses well-proven science, but what we've been able to do is miniaturize and automate it. So I mentioned Quell's worn on your leg. It stimulates sensory nerves in your calf, which then trigger response in the brainstem. Releases endogenous opioids, which block the pain at the delta opioid receptor. And it's all done pretty much behind the scenes from a consumer standpoint. It's clinically proven. We conducted a clinical study earlier this year where we showed 81% improvement in chronic pain and overall health. We showed 86% satisfaction. And something we weren't expecting was 2/3 of patients or people who use the product actually show they reduce their pain meds. And again, folks want to get off the pain medication. Our reaction has been really exciting. I mean, we're really proud of the response we've been getting. We've been able to ship 7,000 Quell devices since we started shipping the product earlier this year. We started shipping in June. Quell was only released to the world at the Consumer Electronics Show in January, where we received Best in Health and Wellness. We were one of the 4 finalists for Health and Wellness. We had a successful crowdfunding campaign on Indiegogo where we reached our campaign goal in 1.5 days and blew through that campaign goal. And we've been getting really great response, and that's because we have a unique solution for chronic pain. But I guess at the end of the day, what really gets us excited is the patient impact we're having. And these are some examples of reviews we're getting on Facebook, et cetera. But I just want to read one quick quote. This is from a 21-year-old patient in South Africa. She said, "My pain has continued to improve in the last month. There are days when I'm 100% pain-free, and it's wonderful. I went for a walk for the first time in years yesterday. Our goal is to let more people regain their lives and take that walk." Thank you.
Thank you. Next up is Chris Economist from Fizz IQ. He's the Vice President of Business Development, and he's responsible for all commercial and go-to-market activities for the company.
Well, I'll soft shoe it, as they say. I'm Chris Economist with Fizz IQ. I appreciate the opportunity to be here today. I was going to show you a picture of Ruth. Ruth is a heart failure patient. As many of you know, she's one of tens of millions of people dealing with acute on-chronic conditions like heart failure and COPD. Now, one of the things about Ruth is that her physiology is unique to her, just like all the challenges that she faces are unique to her. And so what Ruth needs is a solution that allows her to see what's going on with her physiology before it actually happens so that she can avoid, and her health team can help her avoid hospitalization. And that's exactly what we provide. In fact, this is what we provide for everybody, our personalized machine learning-based analytics for data coming off of wearable devices to transform physiological information and vital signs into meaningful, personalized clinical information. Now, unfortunately, I don't have the video to show you here, but the way that this works is that our technology takes continuous vital sign data from wearable devices. For example, heart rate, respiration rate, and activity. And it uses this data, and in fact, it uses the first 24 hours of this data to build a personalized model of Ruth's cardiopulmonary physiology. In fact, it's building a model, a personalized model of the relationships between her vital signs. Now, Ruth is at home, and so her vital signs are going to express a tremendous amount of variability throughout the day. And that presents a challenge to a clinician who's looking at ambulatory data. And so the way that we overcome that is by learning the relationships between those vital signs and in establishing a personalized dynamic baseline of the relationship between those vital signs. And when Ruth's physiology begins to change, for example, from compensatory behavior that might be occurring in advance of a heart failure exacerbation, the system indicates that because it's able to measure it from that dynamic baseline that was created. And the system then rolls all of this change into an index. And that index is something that's measured or read by a clinician. A low index indicates that the patient's physiology, her cardiopulmonary physiology, the relationships between her vital signs are behaving as expected based on the artificial intelligence and machine learning that was derived model. Now, when that index starts to climb, it's indicating that there are very subtle deviations between her actual vital signs and that personalized model that was created. Now, we don't expect a clinician to look at data at an individual level, so this index is then presented within a population management user interface, so clinicians can see those patients within their population whose physiology is fundamentally changing, the vital sign patterns are fundamentally changing, and then those who are not. And I think a great example of the impact of this is from one of our current heart failure studies. Again, wish I had this slide. This is a patient, this is hot off the presses actually, this is a patient who's enrolled in a heart failure study. They went home from the hospital wearing a wearable device. That device was transmitting heart rate, respiration rate, and activity. The first 24 hours, the system learned that patient's physiology and then flipped into monitoring mode. Now, that happened on September 3rd or so, that patient was discharged. About 2 weeks later, our system began to indicate that there were changes and that index started to climb. 13 days after that, that patient actually went into the hospital for a classic heart failure decompensation. Now, this was an observational study. There were no clinicians looking at the data. We just wanted to see how far in advance our technology was able to indicate that something might be going wrong. And the technology showed us that 13 days before that heart failure exacerbation, this patient physiology started fundamentally changing, which would have been amazing to have those 13 days to head that off and avoid the hospitalization. And furthermore, that patient wore the device through the hospital, and we actually showed how their physiology improved to baseline before discharge. This is personalized physiology analytics, and we are Fizz IQ. Thank you.
And extra applause for being such a good sport. Okay, so Mr. Jeff Cutler from Tyto Care. He's the Chief Revenue Officer of Tyto Care, has over 25 years of experience in digital information and healthcare, including starting and running several successful internet sites. And prior to Tyto, Jeff spent over 6 years at Vitals, where he helped build and lead one of the top healthcare transparency platforms.
Good morning. First of all, thank you to Partners Healthcare and the judges for this prestigious honor. And thank you, Deborah, for the introduction. Tyto Care is the first comprehensive digital platform to enable examinations either in a physician's office or remotely, wherever the patient may be. It contains built-in attachments, an otoscope, a stethoscope, other tools to enable full examination of eyes, ears, nose, throat, skin, heart, and lungs. Our vision is to become the leading home healthcare platform. In essence, what we do is we take telehealth and virtual consultations behind the limitations of audio and video to once again be able to conduct a complete physical exam. The device itself, incredibly small, intuitive, easy to use. This is it. It is as simple as, I know you can't see this, but I'll show you afterwards, selecting the patient, swiping through, choosing the exam. I'm going to choose to take a temperature. I'm 98.3. It is that easy, and it's that easy to do the heart, the lungs, and all the other examinations. Whoops. Go back to the video, I'm sorry. What you're going to see for the next 2 minutes is a video of the way Tyto Care actually works. What you're seeing here is a patient. Tyto Care gets to know your family so that it can tell them exactly where to stand and go into the silhouette. It also has a patented guidance system so that anyone can capture clinical quality readings, whether it be a heart exam, lung exam, ear exam, or whatever. You'll notice a series of both visual and audio signals to indicate to any one of us when we're getting a strong signal. The way it connects to the doctor is the patient choose whether they want to do a live exam with a physician or what we call a store and forward exam if a physician is not available. In this situation, our patient is choosing to discuss their stress and anxiety with their physician. Their physician is live, so they're able to select them. What you're seeing on the right is the physician's dashboard. The physician at that point sees that someone is waiting for them. If they're not available, it would go into store and forward mode. The big image in the middle is our patient, physician on the left. The patient is actually sitting there with the device. Everything they see on the device is also replicated wirelessly on either their smartphone or tablet, whatever it might be. And on the physician side, they're seeing it at exactly the same time. The physician actually enables the exam if they're available and takes control of the device, literally telling the patient through the screen interface where to place it to get the quality signals. In this case, the patient at home is able to capture high definition, high quality clinical images of the back of their throat so that they can determine whether they have an infection without having to go into a germ-infested waiting room. Once again, the physician can choose another exam. At this point, we're going into the ear mode. While it's showing you that, show you the attachments are incredibly simple. Snap right on, and you have an otoscope, which I could then go ahead and conduct my ear exam. After capturing the appropriate examinations that the doctor wants, they can enter their case notes. These notes are completely integrated through standards, through all the electronic health records out there. Upon being saved, they're made available to the patient immediately so that they can either see their own images and or the case notes. And then lastly, as I mentioned before, if the physician hadn't been available, the patient would have chosen to do this themselves through a store and forward technology. I'll cut the rest. I think a demo is 1,000 words, and hopefully you get it from that.
While you're packing up, I'll introduce the last speaker. Yes, applause. So Vanessa McGlaughlin is founder and CEO of Welcome Home Health. She's a nationally known expert in telemedicine, remote healthcare delivery, and has more than 15 years experience in industry. She's an author and adjunct faculty member at Portland State University.
Good morning. It's exciting to be here. Thank you so very much, and I'm really excited to get to tell you about Welcome Home Health. 4 minutes isn't very long to share our story, so I decided that I would tell you it through the lens of one of our patients. Let me introduce you to Colleen. She's a 50-year-old. Let Colleen talk.
I was at home, I felt alone, I didn't know where to turn. After my second back surgery, I was lucky enough to try Welcome Home Health. It was amazing. I felt I had someone with the push of a button. I just felt like I had a friend, and I can't say enough good things about Welcome Home Health.
Colleen is a 50-year-old woman. She is a middle school teacher. She lives 70 miles away from her surgeon and her healthcare system. And a year ago, she had back surgery that didn't go so well. This summer, she had her second back surgery and was able to have Welcome Home Health be issued and support her when she left the hospital. She was sent home with a tablet with one button push, connects her directly to our video health advocates. I'll give you an example of that now.
Hi, Colleen. How are you doing today?
Hi, I'm pretty good.
Good. Well, let's jump in there and get your vitals for today. What's your heart rate?
My heart rate today is 78.
Okay. And your blood pressure?
It was 135 over 85.
Okay. That's a little high for you. Have you had any changes in the last day or so?
I've just been in a lot more pain.
Okay. Can you tell me on a scale of 1 to 10, with 1 being the worst you've ever felt and 10 being the best you've ever felt, how do you feel today?
Let's say about a 6.
Okay. Next time I see you, you were going to do your pharmacy reconciliation. So next time I call you, we're going to get the pharmacist on the line to take a look at your meds.
Okay.
All right. We'll see you later.
Okay, thank you.
To prevent readmissions, our 30-day program includes a medicine reconciliation, I say at the kitchen table, it's true, health coaching, scheduling of follow-up appointments, scheduling of transport if the patient needs it, and also scheduling of community resources as provided in the care plan that their doctors provide us. Let me show you now an example of our medicine reconciliation with our pharmacist, Chris.
So I've had a chance to look over your meds. Why don't we just kind of go down the list in terms of what you have in front of you, and then I will just check that off of mine.
I have gabapentin, and I take that 1 capsule twice a day.
Okay.
I've been taking tramadol as needed.
I see that that's something that wasn't on your profile.
I was actually taking a much stronger doses. Tramadol is what I'm trying to ease down to.
Fantastic, fantastic. Okay, well, I will obviously follow up with that and obviously get current regimens, at least that information from the physician, follow up with you on that when I get that response.
So we're a data-driven company. We are a B2B organization as well. We contract directly with health systems, with insurers, and with ACOs. We are currently piloting in New York City with Synergy Home Care and with Mount Sinai Beth Israel Hospital. Welcome Home Health is seeking partners to test our relationship building and connected health work. We're looking for others across the country to help us take next steps. And then just to get back to Colleen, Colleen is healing. She's back to school teaching 6th graders. God bless her. And in her exit interview, she asked that we please put a Facebook page up so she could stay connected with her health advocate, Jessica.
Thank you so much.
Thank you.
And thank you to everybody. Another round of applause for all of our 10 winners, and on to the next session.